Welcome to another edition of Beyond the Scalpel. I'm one of your hosts, Dr. Elie Levine.
And I'm your other host, Dr. Jody Levine. You can find out more about us at plasticsandderm.com.
We are going to be focusing today on surgeries and timing. What do I mean by that? How long do procedures last? And how long does it take to begin to see the results of a procedure? Both of which are some of the key points that people really want to talk about when talking about any procedure, when they're coming in for consultation, when they're deciding whether to proceed, involve themselves in some sort of rejuvenative procedure. And it's a great topic.
Yes, it's very important. I think it's something that a lot of doctors sometimes don't mention, and then people are surprised. So, Dr. Elie, I think your surgeries are probably not obvious how long things last. So let's start with a facelift. Is it forever if someone has a facelift?
So the thing that everyone really needs to keep in mind is that we are constantly aging and constantly evolving. And so nothing is stagnant. And so when you look at these things and you time these things, it's not just about how much you get from the procedure and how long the procedure is going to last, but how much is your normal aging process going to offset that? So with regard to facelifts, the answer really varies a lot depending on how old you are when you get that facelift.
Okay.
So if you are in your 50s, which is on the earlier side of facelift, and there's some people that come in at 50 and really say, I really love a facelift. I take a look at them and I say, you don't need a facelift. You need Dr. Jody for something, but you don't really need me at this point. And others who, unfortunately or fortunately, would benefit from a facelift. And those patients, because their skin has better skin quality at that point, they may have undergone less photo damage and lost less volume in their face, can last anywhere from 10 to 15 years.
Okay.
On the flip side, you look at the other extreme, patients that are in their like 70s to 80s, and those patients, I'd say like anywhere from 5 to 10 years in terms of how long they're going to last from the procedure.
Interesting. So there is a benefit to getting a facelift when you're younger.
Yes.
It will last longer.
Yes.
But it's not realistic to expect that if you get a facelift in your 50s, that in your 80s, it will still be super tight.
Correct. And some of that is that I'm doing procedures differently. So in a 50-year-older who wants to either continue to look 50 or look a little bit younger, it's pretty easy to do that in a way that's going to look unbelievably natural. For someone to look in their 40s to 50s. If someone comes in 70s to 80s, and theoretically, I can make them look spectacular to the point where maybe they look 20 to 30 years younger. However, there's going to be a significant disconnect to other body features. If their neck has a lot of photo damage, it's going to be a dead tail sign that, clear sign that they've had,
right.
This doesn't really match. If their hands look older, so many other things. So the goal is not to make that 70 or 80 look 40 to 50.
Right.
And so if you're only really trying to dial back the clock 5 to 7 years so that they look spectacularly younger but natural, then it's not going to last as long in terms of what they're going to get from it.
Okay, now the next question some people will ask, because I know my patients will ask me, is let's say someone comes in, they're 56 years old, they want a facelift, they know they need it. Will getting a facelift at 56 impact your ability to do one 15 years down the road?
No. So if you go to a well-trained plastic surgeon, someone who really has an experience with a lot of facial rejuvenative procedures, then it is not going to be any more complicated to address those changes a decade or more later.
Okay, so it's not like you build up scar tissue that will then make it more difficult to do surgery down the road.
It probably takes me about an extra 15 to 20 minutes to do a procedure like that, but in terms of healing and results and predictability, everything is spot on.
Okay, and along those same lines, I get asked often if patients do certain laser procedures or fillers, will that create scar tissue that will prevent them from getting a facelift? And have you seen that to be an issue?
No, it seems to do just fine.
Okay. Some of the other things, yes.
So if someone has undergone a facelift, do you find that their response to a laser treatment is less predictable? Or even though a facelift, even the LevineLift, where we are integrating multiple modalities, including fat transfer, those patients still over time will benefit from things like laser resurfacing and Botox and fillers and things like that. Is it less predictable, the outcome or the longevity of their fillers in those situations?
Everything's just going to look better. Once the smaz layer, or, to not to use technical terms, but the foundation of the face is tighter and younger, everything else just does better on top. So I always think it starts smart to start with the foundation and then build up from there. Now, along the lines of speaking about longevity, just to take a break from surgery for a second, let's talk about Botox.
Yeah.
Botox or any of the neuromodulators, Botox, Xeomin, Dysport, Daxxify, how long do they last? So it only lasts, most of them last 3 months. That's it. Now, the actual chemical is lasting for 3 months. It can take maybe a month or two more till the lines come back, but the muscle is relaxed only for 3 months. But now there is a new neuromodulator called Daxxify that lasts almost double the amount of time. So that's exciting.
It is.
Yes, and my patients are loving it. The only thing that people have to realize is that when we say it lasts, let's say 5 to 6 months, that doesn't mean you go from being perfect to now all my lines are back in one night. So over time, you are going to see some lines coming back, some more movement. That doesn't mean the neuromodulator isn't working anymore. It just means it's making its way out.
Yeah, that's a hard part, I think, for people to kind of capture, is it's not an all or none thing.
Right.
It's just a gradual return. It's the same thing with volume loss from fillers. It's not like everything looks spectacular one day and all of a sudden hollowed out the next day.
Correct. Yeah, so one common problem may be that people will come in and say, my Botox doesn't last as long as other people's, because they hear it's supposed to last 3 months. And after 2 months, they're starting to have a little movement back. But that is fully normal. Okay.
Have you found, and there's this ongoing debate, and you hear some of this from some of the companies that manufacture these products, and some of it from different forums, where the question is that if you use higher doses, is it going to last longer?
That's a really good question. So the answer is yes. If you load up someone's face with a lot of Botox up to a certain point, it does last a little bit longer. The problem is you also look like someone who has zero expression. So it is a very fine line, and it is an art to find the right amount that will relax your muscles so that you don't have the lines and your forehead is perfectly smooth, and around your eyes you don't have the crow's feet, but you still need to be able to express. You need to be able to show emotion. You can't look fully frozen. So you have to find the right balance.
Lasers. How long do they last?
Okay.
And that's such a broad question because there are lasers that affect pigment, the lasers that resurface, lasers more for acne, lasers for pore size, all kinds of different things.
Right. So I think with lasers, the question is usually from patients, not how long will it last, but how many laser treatments do I need till I get the effects I want? Because let's say we're talking about photo rejuvenation where we're getting rid of all the sun damage. We're getting rid of sunspots on the outside, and we're also getting rid of pigment that's been laid down from the sun over the years under the skin that causes your skin to be dull. One treatment with the right laser will definitely make your skin glow, will definitely make you reflect light and look young and alive and vibrant. But one treatment alone is not going to get rid of every single sunspot. So then you do it again. And often the very first time someone comes in, if they have a lot of sun damage, I recommend 4 treatments once a month. And that will last in the sense that those patients never look like they did before they came in for laser. Their face will always be more vibrant. But if they go in the sun, they will make new sunspots, which we can then get rid of with one treatment usually. Off of the face, let's talk a little bit about the body. How about breast implants? If you get breast implants, are those forever, or are you going to need them again?
So there's this conception out there, and you hear it everywhere, anywhere, all the time, is that implants last 10 years. Patients come in with that assumption, with that question, and it's not really true. So implants are, every one of the manufacturers that are out there right now, implants last longer and longer, and they are better made as technology continues to improve. And so it is unusual to see a rupture. I would say the most common scenarios where I see ruptured implants are either implants that were put in multiple decades ago, or patients that have unfortunately been in high-speed motor vehicle accidents where airbags have deployed. They've been really hit pretty much with high-speed accidents. But with the exception of that, generally they do pretty well. I think that 10-year kind of concept came about where if someone comes in, let's say at 22, and undergoes a breast augmentation, and then over the next, let's say 10 years or so, they have two children and they have weight fluctuations here and there, and they come in now in their mid-30s and they go, my chest doesn't look as good as it used to look. So it's not that they need to change their implants, but they may benefit from a slightly different shaped implant or a slightly different sized implant, or maybe combining an implant with a different implant with a breast lift or something else. So it's more of a, I don't feel like my chest looks as good as it used to look. And it's not so much that there's a problem with the implant as much as they've gone through, normal aging processes, and that's really more that they're looking for a form of a partial mommy makeover than really changing out their implants.
Okay, that makes a lot of sense. So if someone comes in, say they're done having their children and they're an adult and they just want a larger chest, then those implants can last, you're saying.
Right. So people like that, let's say someone comes in and they're, 37 years old and they say, I'm done having kids, and they want to do something with their chest. And they undergo a breast augmentation. What I really tell them is that, listen, theoretically, anything could happen to an implant at any time. However, you need to kind of go into it assuming that at some point in your life, maybe in 10 years, but probably not, it could be in 30 years, you'll probably want to undergo some sort of procedure to change something, but it's not going to be the kind of thing where every decade you're going to have to deal with this.
Okay, very good. Yeah, I've seen patients whose breast implants still look great 20 years later.
Yeah. And if they're not having issues with it and they're not undergoing another procedure anyways, or they're not doing anything else, there's no reason to necessarily do anything about it.
Change it.
Now, if you're going in anyways and you're doing your mommy makeover, let's say you do a breast augmentation in your 20s, and then you're coming in now, it's 20 years later, you're doing your mommy makeover and you're doing maybe some liposuction and a tummy tuck. Is it not unreasonable to change them out at that point? Yeah, I guess that kind of makes sense, so that a decade later, they're not having to deal with that again. But
right. So when we talk about a patient having to change their breast implants, you mentioned rupture as being one reason. With the exclusion of them having had children and their breast shape changing, what else could happen to the implant that would tell the person it's time to change it?
So if the shape kind of changes, and the shape can change due to something called capsular contracture, where the capsule with this little kind of, the body normally forms a wall around any implant device, whether it's a breast implant or a chin implant or a hip implant.
Right.
And if that capsule tightens up a little and generally causes some sort of cosmetic change, it's not unreasonable to kind of address that. And each of that there's a threshold there. There's some people where it may have a slight capsular contracture and they're fine with it, and other people where it bothers them, in which case you address it.
Right. Okay. But you take a lot of measures to make sure that capsular contracture doesn't happen.
It's probably one of the most detailed aspects of things. So for example, whenever I'm doing a breast augmentation, at no point am I, even with my sterile gloves, coming in contact with that implant. So the area where the implant's being placed is created. It is irrigated and soaked with 3 different antibiotics and betadine to sterilize the area. And then the implant itself is placed into this sterile sleeve that I use to place the implant in. So at no point is there any contact with the implant. And so the likelihood of having anything kind of in contact with it is pretty much zero. And it takes a little bit longer, but it's the right thing to do to maximize the chance of everything going the way we want it to.
Okay, perfect.
We'd like to welcome Dr. Ram Roth to the show. Dr. Roth is a board-certified anesthesiologist who's been practicing for 25 plus years, and is an associate professor in New York City. And I can tell you, having worked with him firsthand, he is one of the top 3, maybe the top 1 anesthesiologist I've ever worked with. He really is a gifted anesthesiologist and a very compassionate medical caregiver. So welcome to the show.
Thank you very much for having me. It's a pleasure to be here.
So thanks for being here. My first question for you is, Elie always compliments you and says that you are one of the best anesthesiologists. So clearly anesthesia is not just a science, but is an art. So tell us, how do you decide how much medicine to give each patient? What what is the formula? How do you know what to do? Give us a little inside information.
Well, I think that's the challenge of making it an art. Um, you cannot have a cookie cutter approach and give, yes, there's the weight of the patient, there's the health, medical conditions, all the things that have to sort of go into the computation of what you're going to give and how much you're going to give. But there's also a matter of seeing how something affects the patient and trying to gauge whether you need more or less. Um, so uh, I I treat every patient as an individual. I have my goals, which are to keep them safe, to keep them healthy and alive and well, and all these things that we have to do while we're doing anesthesia. But I'm also trying to tune into what they need and custom tailor it that and to what the surgeon needs, right? I need to make my job is to make the surgery possible. So, if I notice the surgeon struggling and raising the bed a few inches might help them, I suggest it. So all of those things go together to make the happy patient, the successful surgery, and the surgeon into an excellent surgeon.
So I think you're hitting on a very good point. Probably something that I failed to mention earlier is, when I say you are one of the best anesthesiologists I've worked with, understandably, someone who has no understanding of anesthesia or healthcare doesn't really understand what that means. And the starting point with any of these kind of discussions is you're not one of the best because you're safe, because that is a kind of prerequisite. That is an assumption. What makes someone great, from my perspective, from anesthesia, is the patients wake up seamlessly. The patients wake up comfortably. The patients are not nauseated after surgery. The patients are not moving during surgery. They just have only complimentary things to say about the entire experience, and that really comes as much from what you do as much as what I'm doing. And so it's really that whole process that really goes into it. What would you say in terms of your background? Because I've worked with, probably between my training and in private practice, 100 anesthesiologists, and some are outstanding and some are, again, all safe. I'm not worried about the safety issue, but the art side of things really are lacking. What in your background do you think helped make you who you are today?
That is an interesting question, and I've been doing this for 25 years, and residents ask me questions and all sorts of things about why I do this, how I do this. But you just reached deep inside of me and asked a question that no one has touched upon. Um, and so I will honestly answer. I think part of it has to do that I grew up with a little sister who's Down syndrome,
Mm.
and I know you didn't know that.
No.
Um,
No.
and I was involved in taking care of her. She was 6 years younger than me. She's the youngest in our family, and I was the closest in age to her. And so a lot of my taking care of her involved tuning into what she needed. So I'll say tuning into my patient is what I do. I never said it that way. You just kind of brought that out of me right now with your question. And I think that I did know in the past that my sensitivity probably comes from having this sister. Her name is Masha. And she's, lives independently today, and she's having a great life in Israel.
Wow.
Um, and that's the source. And just getting back to what you said before about, I like being a team member with the surgeon and the patients included too. But, it's me tuning into the surgeon as well and working together as a team. And I think that's what makes your operating room a very successful place, because you're fully willing to include the anesthesiologist. They're not just there to provide a service so that you can get your case done, but you tune into the anesthesiologist and you add them to your team. So I know all your staff works like a team. So that's great.
So Elie just mentioned one of the, things that sets you apart is that the patients wake up feeling good. So tell us in general, what are some side effects of anesthesia that patients might have, and how do you treat those?
Well, the side effects of the surgery, which are pain, there are we use anesthetics that might make a patient feel weak, so weakness. And then there are the common things that people talk about, nausea and vomiting, which are really disruptive to the healing process, to waking up from anesthesia, to waking up, period. No one likes to do that.
Okay.
So those are things that you try to manage. One thing I like to do that I think is unique is in some cases, anesthesiologists let the patient wake up, and it's kind of at the patient's whim, or the patient is the kind of the deciding factor. I like to think that this is part of my job, to be fully in control and to decide the moment that the patient wakes up. So, for example, if I think that they're still in pain, how would I think that? By observing their respiratory rate and their ability to breathe while still under anesthesia, but before I've totally woken them up. So I like to try to use that time to sort of fine tune anything that's been going on, and choose the moment of wake up and choose the moment of extubation, rather than have it be a random event.
That makes a lot of sense. And I imagine you give them some extra medicine so they will not be nauseous?
Absolutely. First of all, you want to find out right away. Part of the secret of not having nausea is there are patients who present, they show up and they say, I'm always nauseous after anesthesia. Or even if they've never had anesthesia, in my questions beforehand, one of the things I focus on is, do you have seasickness? Do you get, car sick? Are you a cheap date? Is kind of a funny question, but does that mean that, you really can't tolerate half a cup of alcohol? And people know that about themselves. And just like people know that they don't ever take Tylenol or aspirin. Well, that tells me that either they're really sensitive to that stuff or they really react poorly to that stuff. And by asking those questions, I can hear what their body needs and what they like and what they dislike. And that helps guide me.
Okay.
And you definitely, I think you focus correctly on, you're a proactive anesthesiologist. And it's true. I would say that the times where the wake ups have been less comfortable for patients that I've seen over the years, not with you, but with other providers, is almost like they're letting the patient's response to things dictate when to extubate or when to do things, as opposed to being proactive and finding the time that's going to be optimal for people. Just kind of waiting till the last possible moment when almost the patient themselves is pulling, tubes out, rather than you being the one doing it.
Right. That makes so much sense. I never really thought about it that way. Is there anything that the patient can do to prepare themselves for surgery?
There are many things they can do. The most common things you'd want to talk about is getting a good history, being seen by their doctor, knowing that, the job, people want to know, why do I have to go to my doctor before surgery? Well, that person is presumably the person who knows you best medically, and they can prepare information for me that would be helpful. I take that information and further ask the patient questions and sort of try to get the best picture of who they are, what their conditions are, and what their situations are. So what can they do? They can be honest about their health, their medical problems, about their use of alcohol, their use of cigarettes and smoking. It's only for their own benefit. I generally have to say this to a child, and I don't think of saying this to an adult, but, I'm really here to take care of you. And if I don't know that you smoke, marijuana every day, or that you take amphetamines for fun, that'll be a surprise to me. And that's not good for you if I'm surprised.
Right.
So it's about listening to your doctors. It's about getting a pre-op physical, making sure all your ducks are in a row and everything else is taken care of. And then smoking cessation if you're a smoker, because that's going to affect healing, right? And not taking alcohol and not taking other substances that you shouldn't before surgery, because that's just going to complicate the process.
Yes, it's really important to be honest with your doctor.
Yeah.
Okay, one more question for you. Are there any conditions beside the recreational drug use or smoking, any medical conditions that might make anesthesia more difficult?
So I would say it's always a challenge to take care of a patient who has medical problems, but it's worse if the person has medical problems that are uncontrolled. So if you're a hypertensive, not taking your medications, you're a diabetic, not well controlled. If you're obese, that makes our life a little harder. If you have sleep apnea, it doesn't make things easier. Can we manage? Yes. And you should be aware that, sometimes people are surprised that, let's say, it's hard to find a vein, but every time they go to the doctor, it's hard to find the vein. So then you
Right.
try not to be surprised, and give us a moment, and we need to get that done, and we'll take care of you.
Yes. This has been great because I know that when I speak to my patients who are going in for surgery with Dr. Elie, they are most afraid of the anesthesia. That is the part that scares them. The surgery, they're excited for. They want the results. They know it's going to look great. They're scared about the unknown of anesthesia.
Right. I was going to add, for the last question, I was going to say, part of it is to tell me what you're most afraid of, because I'm here to try to comfort you and take care of that. Now, if a patient says to me what you just said, that they are afraid of anesthesia, I say to them, you are absolutely right. And I think that means that you're smart and you're intelligent. But I'm here to try to alleviate those concerns. So let's know, some patients, they're afraid of dying, but some patients, they're afraid they're going to say something while under anesthesia. So you can't assume that everyone has the same fear. And if you don't explain to me your fear, if your fear is throwing up, then it's easy, because I say, okay, well, if I can make sure you don't throw up, you're going to be happy. And they say yes. And so I don't have to worry about them being in pain when they wake up. That's a joke. But the point is, the more I can know what's in their head, the more honest they are with us about everything, I think the outcome would be better all around.
So I've always been disappointed because I really haven't heard anything all that interesting said by patients. Have you heard anything outrageous over the years?
In fact, patients do not speak under anesthesia, so that's a fallacy, and people really shouldn't be concerned. And if they do, it's all confidential. I have had one patient who spoke in the recovery room. He just woke up giggling, and I'm like, what's going on? He says, I just had a great dream. And I was curious. I said, so what was your dream? And he said, I just got the girl I've been after for a long time.
Ooh.
And I'm like, good for you. He goes, don't tell my wife. That's a true story.
Oh, God.
But that was not under anesthesia. That was in the recovery room. He was waking up. He just shared that he had a good time.
That's really funny.
Well, on that note,
yes.
Thank you so much for taking the time to join us.
We really appreciate your insights.
You guys, thank you very much.
So this concludes another episode of Beyond the Scalpel. Please follow us and look for more information at plasticsandderm.com.
We'll see you here next time. Thank you.